My name is Kyla, and I'm going to be presenting to you guys endometriosis. Today, we are going to be talking about a description of endometriosis, signs and symptoms, the etiology, how the disease is diagnosed, what treatments are available, prognosis, prevention, what surprised me the most, and what populations, sex, ethnicities are most at risk for endometriosis. So, first, we are going to be talking about what endometriosis is. And endometriosis is a condition where the tissue is similar to the lining of the uterus, called the endometrium, grows outside the uterus. This misplaced tissue can attach to other organs, commonly in the ovaries, fallopian tubes, the lining of the pelvis, and sometimes even beyond. And here we have a picture of the reproductive organs of a female if you want to pause the video and take a look. Next, we have signs and symptoms. Some signs of endometriosis are heavy menstrual bleeding, bleeding between periods, ovarian cysts, inflammation or scar tissue in the pelvis that can be found on exams or imaging. Some symptoms of endometriosis are painful periods, pelvic pain, pain during sex, pain when urinating or having bowel movements, infertility, fatigue, bloating, diarrhea, constipation, and nausea, especially during periods. The etiology of endometriosis are number 1, backwards period flow, also known as retrograde menstruation, and that is during your period, some blood flows backwards into the pelvis instead of out of the body. Those cells can stick where they don't belong and start to grow. Number 2, cells turning into endometrial tissue, which is when some cells are already in the pelvis can change into cells that act like lining of the uterus because of hormones like estrogen. Number 3, cells sticking after surgery. If you've had a C-section or another pelvic surgery, endometrial cells can attach to the incision and start growing there. Number 4, cells traveling through the body. Endometrial-like cells may move through blood vessels or lymphatic systems, the body's drainage system, to other areas. Number 5, weakened immune system response. The immune system may not catch and destroy the misplaced cells like it normally should. And lastly, number 6, genetic factors. Endometriosis can run in families, which means you're more likely to have endometriosis if your family has it. All right. How the disease is diagnosed. So there are a few ways that endometriosis can be diagnosed. Number 1, including a pelvic exam, which is just when a doctor checks inside for cysts, tenderness, and sometimes scar tissue in the pelvic area. Number 2, they can do an ultrasound. A transvaginal or abdominal ultrasound can show ovarian cysts, but it can't confirm endometriosis. Number 3, an MRI. It can be used to get a detailed picture of the organs and get a deeper look of endometriosis before going into surgery. 4, you can do a laparoscopy, which is the best way to diagnose endometriosis. It's a minimally invasive surgery. and a small tissue will be taken as a sample and it will be tested to confirm diagnosis. And the biopsy is something where they take the tissue before and they send it to the lab. That's during the laparoscopy. And then number 6 are blood tests. So they'll just take some blood from you, and there is a hormone that can be elevated. And if it's high, it can be a good indicator of endometriosis, but it does not diagnose the endometriosis itself. It's just another thing that can help, like the pelvic exam and ultrasound. All right, on to treatments. So, endometriosis cannot be cured, but there are some things that can help. So, number 1 are pain management. Things like ibuprofen, Midol can help reduce the pain and inflammation. Number 2, hormone therapy. Things like birth control. There's many types of birth control. There's an IUD, there's the pill, there's ones that are progesterone only. And then they also make GnRH agonists or antagonists. That is another type of hormone therapy that might help with endometriosis. Some other things that can help are surgeries like a laparoscopy, laparotomy, and hysterectomy. And the hysterectomy is the last resort. Lastly, you can change the way you live. You can exercise more, eat healthy, manage your stress, and then there is pelvic floor exercises you can do that may help. The prognosis. Endometriosis is a chronic condition. There are no guaranteed cures, sadly. Treatment aims to manage symptoms like the pain and bleeding and improve the quality of life and or fertility. With appropriate pain relief, hormones, surgery when needed, people can have symptom relief and remain normal to their daily functions. But sadly, the symptoms may recur. Lesions removed during surgery can regrow and reappear because the underlying causes are not fully understood today. The severity of symptoms doesn't always correlate to how much endometrial tissue that there is. All right, number 9, prevention. Because we don't know why exactly endometriosis happens, fully preventing it is still unknown. Living a healthy lifestyle, reducing inflammation within your diet, stress management, exercises are the best way to prevent it, but there are no proven ways to prevent endometriosis. Who are most at risk? Obviously, females. You are only able to get endometriosis if you have a uterus. Early onset menstruation. If you have your period at a young age, then you are more likely to get endometriosis. If you have short menstrual cycles that happen more frequently, you are more likely to get endometriosis. Often, if you have heavy periods or prolonged menstrual bleeding, you are more likely to get endometriosis, and your family history. If you have a mom or a sister who has endometriosis, that also increases your risk. And then to the right, I have a picture of the menstrual cycle phases. And then some things that surprised me. It is the leading cause of infertility. 30 to 50% of women who have periods get endometriosis. And with that, it's one of the most misunderstood women's health conditions, yet it's one of the most common, has the least research done on it. It can be as common as asthma or diabetes. Endometriosis affects 1 in 10 people with a uterus. And then pregnancy has been told that it can help cure it, but it's not appraisal, like it's not for sure going to cure it. Symptoms can get better during pregnancy, but the condition doesn't go away. It can just be better during pregnancy because you're not having a menstrual cycle during those 9 months. And then my credits. I use Mayo Clinic and the Johns Hopkins Medicine. All right, thank you.